Innovation in health has been a great success story, doubling life expectancy globally over the last 100 years. But today's health systems face unprecedented challenges. The need for global collaboration to diffuse innovation and best practice has never been more critical. WISH, an initiative of Qatar Foundation, is providing a global platform for policymakers and leaders to work together as a catalyst for change in healthcare. Founded by Her Highness Sheikh Hamza bint Nasser and under the chairmanship of Lord Darzi, WISH is creating a global community of change makers. Led by Qatar Foundation and its partners, this year's evidence-based WISH research forums will focus on some of the world's greatest health challenges and help close the gap between what we know and what we do. In the 21st century, over 1 billion people still lack access to health care. We need to be the generation that delivers universal health coverage. How do we communicate more effectively to help people make smarter choices about their own health? Not least because of the increasing growth rate of chronic disease, 1 in 10 are predicted to have diabetes in 20 years' time. Cancer used to be a death sentence, but is increasingly curable. Our challenge now is affordability. There is no cure on the horizon for dementia. Increasing lifespan means the number of people with dementia will triple by 2050. Today, 1 in 10 patients are harmed receiving care. Healthcare needs to learn from other high-risk sectors how to design and deliver improved safety. Half of all mental health problems emerge by the age of 18. An investment in our children's mental health is an investment in our future. Together, we can make a difference. WISH, a healthier world through global collaboration.
That's very kind, so early, thank you. Your Highness, Prime Minister, Your Royal Highnesses, Your Excellencies, Ministers, distinguished guests, ladies and gentlemen, welcome to the World Innovation Summit for Health in Qatar 2015. I'm delighted to be here to host the second WISH conference. It is an important event. In fact, it's hard to think of any event of its kind that is more important anywhere. It brings together individuals from all over the world with expertise and commitment to deliver better health for all. They share experiences, they listen, and you learn. I want to add a brief footnote. In my professional life, I've had the fascinating privilege to travel. I've seen in health the best and the worst, and a great deal somewhere in between. And it's often prompted me to think, yes, medical advances matter hugely, of course they do, medical skill and expertise, but it's also resources, and especially the efficient use of resources. And not least, it's about breaking down those ideological barriers that says ours is the best. I don't really need to listen to the others. So this is about sharing experience, listening, learning, and discovering. It hardly needs to be said that health for all of us, and not least for those whom we love, matters hugely. It's hard, in fact, to think of anything more important, which is why I know that these 2 days are going to be of real value to everyone. So who are you? Well, I mean, I know you know individually who you are, but in summary, you are over 1,000 in number. You come from more than 80 countries in all 5 continents. Those of you who were here last year have played a significant role in helping to shape this year's conference. Look around you. A Healthier World Through Global Collaboration is the title. Mental health and well-being in children maternal and newborn health, patient safety, dementia, delivering affordable care, communicating complex health messages, healthcare and ethics, genomics, diabetes, universal health coverage. So that is a hugely important set of topics, and those are the issues that matter to you. And this year we've got an innovation as well. The policy briefing sessions, these arise directly out of your involvement last time round. Subjects like obesity, road traffic accidents, end-of-life care, and mental health. Now, so many of you want to attend these that some of them are oversubscribed, and I'm afraid you will therefore find it difficult to get in. And now, to set us on our way, it is my pleasure to introduce the Executive Chair of WISH, Professor the Lord Darzi of Denham. It's no exaggeration to say that Lord Darzi has dedicated his life to improving the health of others, not only on the front line as a now eminent surgeon, but also in the United Kingdom Parliament as the Minister of Health in the last government. He's also been the UK's Global Ambassador for Health and Life Sciences. He's been honoured around the world for his many contributions in this field, most notably in January last year when His Highness Emir Sheikh Tamim bin Ahmed Al Thani, sorry for that, sir, bestowed on him Qatar's greatest honour, the Sash of Independence. It's a measure of his qualities that he's been the architect who's translated Their Highnesses' wishes, Your Highnesses' wishes, for WISH to succeed. As well as continuing his practice as a surgeon, he's worked tirelessly to make this event a success. I just want to add a personal note. I've been pretty lucky in life, and I've met a lot of remarkable individuals. And I have to say that Ara Darzi is undoubtedly one of these. Please welcome Professor Lord Darzi.
Assalamu alaikum. Your Highness Sheikh Moza bint Nasser, Prime Minister Sheikh Abdullah bin Nasser Al Thani, Your Royal Highnesses, Your Excellencies, distinguished guests, ladies and gentlemen. Good morning and welcome to WISH 2015. It is my privilege to introduce Her Highness Sheikh Moza, who will open the summit with her gracious speech. Sheikh Moza has been a driving force behind education, health, and social reforms in this country and around the world. Today, under her leadership, ministers from 19 governments from the Americas, Africa, Europe, the Middle East, Asia Pacific are gathered here in Doha. We are privileged to be witness to health diplomacy in action, building stronger bonds between nations through our common health. It is an expression of a simple idea. What we share with one another is far greater than that which pulls us apart. It is the expression of a bold vision to bring every part of the world together to find innovative solutions to common challenges. The courage to have a bold vision and allow to follow ambition with action is the hallmark of Qatar. There is no greater example than the world-famous Qatar Foundation and its chairperson, Her Highness. Qatar Foundation celebrates its 20th anniversary this year. What you have achieved in 20 years is remarkable, and our wholehearted congratulations to you, Your Highness, and all our colleagues at Qatar Foundation at this important milestone. The flagship project of Qatar Foundation is Education City, which gathers together some of the world's greatest universities and institutions. Universities that are thousands of miles apart globally are streets apart in Qatar. Education City now counts some 2,500 people as its proud graduates. It is an enduring achievement for Qatar, for the region, and for the advancement of education in the world. It is an achievement made possible because of Her Highness's belief in the power of education to transform lives here in Qatar and around the world. And so, Her Highness's contributions to education have been recognized at the highest levels by the United Nations, and these achievements have been mirrored in her contributions to health. Your Highness, your passion and your energy led to the creation of this World Innovation Summit for Health, which first took place in 2013. We are honored, delighted and humbled to be welcomed back to Qatar for this important and historic meeting. Without your leadership, none of us would be here today. From all of us, our heartfelt thanks. Your Highness, may I welcome you to the stage.
Thank you, Adam. I'll be speaking in Arabic. السلام عليكم السيدات والسادة.
Assalamu alaikum. Ladies and gentlemen, I am very happy to meet you and to welcome you back to Doha, and I applaud your continued commitment and contribution to the World Innovation Summit for Health, WISH. I am pleased to welcome representation from over 80 countries, 20 countries around the world, and we are honored by your presence here in Qatar, and I hope that you will find three things from your stay here. First, I hope that you will learn about innovations that can improve your health systems when you get home. Second, I hope that you will build your networks of friends and colleagues in other health systems, the community of health system leaders. And third, that you have the confidence that WISH remains as a benchmark to use in the advancement of healthcare and health policies. Today, as we convene again on the occasion of WISH, our aim is to share a discussion on the healthcare issues and find solutions. And we cannot overcome our healthcare challenges unless we begin to invest in solutions that link health and education, as health and education are intrinsically connected. And innovation in education leads us to innovation in health. It is our wish to promote the cause of both access to basic primary education and universal health coverage. Ladies and gentlemen, statistical figures indicate that there are, and we can say that both health and in education are intrinsically linked. Ladies and gentlemen, statistical figures indicate that there are at least 1 billion people who have no access annually to the health services they need. 250 million out of them are devastated by the financial consequences resulting from the fees they pay for such services. Against the backdrop of such statistics, the WISH conference brings together decision-makers, partners, scientists and experts to help change our global health reality
فما نتطلع إليه
one that works towards achieving a greater ambition of providing quality health coverage
الصحية النوعية لكل
for all,
إنسان حيثما كان.
wherever people are.
لذلك نفعل حقوق الإنسان.
Healthcare and healthcare access go to the heart of human rights.
بل عن إحقاقها. وبما أن توفير
We shouldn't talk about human rights and healthcare, but we should improve its implementation. Providing basic healthcare for all is not the only concern we share globally. Collective challenges include the emergence of new and serious epidemics.
فيه مع الكثيرين في العالم لم يعد مقتصرا على ضرورة توفير الرعاية الصحية الأساسية.
And it's no longer providing healthcare and basic healthcare only. It concerns the sudden emergence of new and serious epidemics.
وعن التركؤ في علاجها وآخرها.
And we talk much about their reasons.
كلها أمراض ناتجة عن ظروف غريبة.
Ebola.
خارج مشاكل
These illnesses come from unconventional origins, and they are outside our traditional healthcare concerns. Does this mean that from time to time the world is susceptible to the invasion of such epidemics? Do we ignore the skeptic voices that question the origins of these diseases?
السيدات والسادة.
Ladies and gentlemen,
أردنا الوش منذ البداية
from the beginning, we wanted WISH to be a platform
اختبار الأفكار
to test ideas, research, and the highest levels of scientific progress made in medical care around the world. We also wanted to be a venue to measure the absorption of innovation, to gather decision makers, companies, academia, and specialized persons, and those who can and will influence policy change in order to support the idea of the necessity of change. Innovation does not spur out of a political decision. It can only do so if it is embedded within the social and cultural fabric as a natural outcome of development. For Qatar, WISH makes an important contribution to improving our health system, and we used it to consolidate partnership.
وذلك لتطبيق أبحاث وتوصيات
The task force,
2013. ونجح
an
مستشفى
implementation task force was launched with the specific responsibility of translating evidence into policy and policy into action. And also the Hamad Hospital was also involved in looking at the different patients and the patient need. And also there is a network for youth and young innovators to support the future of innovation. Recently, a new biobank building has been opened, which will help support the Qatar Genome Project, which we announced at last year's summit. This will help move us toward personalized medicine in the future. It is also our belief that the people of Qatar deserve excellent care here at home. That is why we are investing in excellence in patient care and clinical research at Sidra, which will be a world-leading medical center. We have adopted health insurance in Qatar, which aims to create competition between the public and private sectors and raise the level of care in the service of the citizens. Ladies and gentlemen,
في التصدي للتحديات الصحية القائمة في العالم
conventional solutions will not work to address our current global health challenges. So, perhaps the ultimate goal of our coming together at WISH is the need for innovative solutions to these challenges. Be at the forefront of innovation, and we will be with you at the forefront of supporters. May you succeed in your endeavors. Thank you, and may the peace of God be bestowed upon you.
Your Highness, thank you for that inspiring opening. I wholeheartedly agree with what you say about the importance of working together to meet global health challenges. For me personally, it is a great privilege and an honour to be asked to lead WISH on your behalf and on behalf of Qatar. It is through your energy, your commitment, that policymakers, industry leaders and distinguished thinkers have been brought together here in Qatar on an unprecedented scale. WISH brings the world to Qatar and Qatar to the world. It may have started as a wish or a dream, but as always, Your Highness, you have exercised your unique and exceptional ability to turn this wish into a reality. And so we meet here, now, in Qatar, the regional crucible for innovation, for science, for technology, and for medicine. It is truly a global crossroads. There is no better place to gather our international community of health reformers. I am grateful to all of you for your commitment, your time, and your energy in participating today. A little over a year ago, we met here in Doha for the first WISH Summit, united by our own commitment to reforming health systems and improving the health of our populations. More than 1,000 policymakers, industry leaders and academics from nearly 70 countries and representing more than half of the world's population gathered in this great hall. As we met together, the world watched. More than 900 articles were published in 50 countries and in 15 different languages. What the participants contributed and what they learned was spread across the globe through 10 articles in the world's leading health policy journal, Health Affairs. The winner of the 2013 Innovation Showcase, an adopted motorcycle called the E-Ranger, used to transport patients over tough terrain, is now being used in refugee camps in Ethiopia and Uganda. The WISH report on antimicrobial resistance was highlighted to the world's health ministers at the 2014 World Health Assembly in Geneva through the partnership between WISH and Qatar's Supreme Council of Health under the leadership of His Excellency Abdullah Al-Qahtani, Qatar's Health Minister. We meet for a second time. We have much to live up to. This year, we again welcome some of the world's original thinkers, and we will hear from leading experts in panel discussions on the most pressing global health challenges and innovations. We will cover the full spectrum of health, from showcasing practical products impacting daily lives to a most distinguished panel debating the moral and religious implications of personalized medicine and the human genome. The summit hosts the state of the art in health. We come to share and to learn in the face of common challenges. We want to share and to learn about the new frontiers of innovation for better health for all people everywhere. I will touch briefly on those challenges, on the frontiers of innovation and what it means for better health for all people everywhere. We face a rising tide of non-communicable disease, chief among them cancer, diabetes and dementia, which we will address this year. It is one of the defining challenges we face. This scientific challenge has become a financial one. How can we afford the rising cost of care? The global bill for cancer treatment alone stands at $290 billion, a sum equivalent to the GDP of Hong Kong. Our forums show how we can achieve more affordable cancer care. On this day, 350 million people around the world suffer with diabetes. In 20 years, that will double to 1 in 10. Our work this year described what great diabetes care looks like, and the new innovations to arrest the growth in this disease. On this day, 44 million people around the world, the same as the population of Spain, suffer from dementia. Rates are rising rapidly as our population age. We urge all governments to act with resolve to improve prevention and care and to open up innovations in treatments. Yet as we rise to meet those challenges, we must always remain vigilant for the next threat from new communicable diseases, which can emerge without warning. In the past year, we have seen the outbreak of the Middle East Respiratory Syndrome, or MERS, which has challenged health systems across this region. And of course, the world has woken up to the horror of the outbreak of Ebola in West Africa. In the eyes of many, Ebola caught the global health community sleeping. We must listen carefully to the criticisms that lives have been needlessly lost as a result of the paucity and the pace of our response. The moral resolve of saying never again must be met with a resolute change. The public must be mobilized for public health. This is why we have examined innovative approaches to encouraging the public to act responsibly through better communication. Governments around the world must learn the lessons and adopt change. I am pleased that WISH is showing the innovations we need to secure our health. We must embrace innovation we need for the health we want. On show are 20 of the world's most exciting innovations, ranging from practical devices to new business models designed to transform healthcare. And we are welcoming, for the very first time, participants of the next generation of health leaders, our young innovators and our apprentice innovators. In these young men and women who have the potential to change the world. We have extended our pioneering program on the global diffusion of health innovation to examine how new ideas have spread in practice. Our model accurately predicted in which countries innovative ideas would take hold. We will hear stories from individuals inside 8 successful health systems, from the Americas to Zambia, from Sweden to Singapore, from Nepal to Northern Europe. We have also partnered with the health systems, including Victoria and Queensland in Australia, Vancouver in Canada, Glasgow in the United Kingdom, and Singapore through the Leading Health Systems Network. The network collaborates to share health system performance data, to identify what they can learn from each other, and to implement practical changes in each system. Yet sometimes the innovation that we need is to bridge the gap between what we know and what we do. Throughout my career, innovations in patient safety have been a passion of mine. As a surgeon treating patients every week, I was heartened by the report Transforming Patient Safety. It sets out the innovations we need to reduce the numbers of errors and mistakes. Yet the magnitude of mistakes is nothing compared to the suffering that comes to millions who cannot get access to even the most basic care. For every individual, every family, health comes first. When a child is born, parents anxiously wait confirmation that their child is healthy. That is what matters. Yet this year, nearly 300,000 women and girls will die unnecessarily in pregnancy and in childbirth. There has been a tremendous progress since the Millennium Development Goals were set, but there is so much further to go. This was one of the first Forum reports produced back in 2012, and I'm delighted to announce that this year, WISH, in partnership with the Bill and Melinda Gates Foundation, have revisited this important area to further explore what policymakers can do to sustain the momentum, indeed to accelerate progress. We owe all our children a healthy and a happy childhood. The innocence of childhood is precious. However, it is too often punctured by sadness and by poor well-being. This year, in partnership with our sister event, the World Innovation Summit for Education, WISE, I am proud that we are looking at how to improve children's well-being by providing support to families, creating caring communities, and improving schools. Finally, for all people everywhere, we must redouble our efforts to achieve universal health coverage. By becoming Here to Wish, you have demonstrated your belief that healthcare is a moral right to be secured for all, and not merely another good to be purchased. Before you arrived here in Doha, we asked you what mattered most. Overwhelmingly, you told us that universal health coverage should be the top priority around the world. I agree with you. And so, I'm proud of the work of our forums on universal health coverage and its call for politicians around the world to act, and act now. You have acted by coming to Wish. In the next 48 hours, we are going to expect a lot of you, as you expect much of us. There are more than 1,000 people in this room. Each of us has something to offer, and each of us has something to learn. Each of us has expertise we can give, and all of us have expertise that we need. We all have stories of success. We all have stories of failure. We will learn from our mistakes, and we will also celebrate our successes. We will support each other, and we will inspire one another. We are a global movement of health reformers, and we are here to share, to learn, and to join our revolution in health for people everywhere. Have a fantastic time in Doha, and thank you very much.
Lord Darzi, no one could have set out the challenges facing the next 48 hours and the world outside and beyond more clearly than you've just done. Now, to help steer us through the 2 days approaching these challenges, we've got 4 keynote speakers. They are individuals from different perspectives, but they're universally held in high regard. They are Dr. Don Berwick, Mark Bertolini, Dr. Devis Shetty, and Anthony Shriver. Now, I'll tell you more about those individuals as they come to speak. Meanwhile, I have to do a tiny bit of housekeeping, but it's very important. Those of you who, like me, have learnt to use a computer and even have learnt what an app is, please download the Wish app, which is interactive. It keeps you up to date with the agenda. It allows you to make connections with your fellow delegates, and very importantly as well, to submit questions, make points in the panel discussions. It's therefore one of the key ways to ensure that this conference allows everyone to share their experiences, as Lord Darzi was referring to, and to make the most of that opportunity. And of course, there is our good young friend, Twitter. Please tweet away. The hashtag is Wish2005, Wish 2015, Wish 2015. I also want to add a big thank you to our sponsors. They should be all around you, up there, maybe. Yes, there they are, a lot of them, so I won't list them all, but of course without them this would be a much more difficult project to achieve. They are critical to it. That said, Wish 2015 is now officially open, and we are ready to go. And with that brief pause, it's my honor to introduce the first of our 4 keynote speakers. When discussing innovation and improvement in health care, the hallmark themes of Wish, one thought leader comes consistently to mind. Dr. Don Berwick has had a full and distinguished career with an unfailing dedication to improving patient care. He served as the president and CEO of the Institute for Healthcare Improvement for nearly 20 years, helping to reduce medical errors and improve care in over, more than 70 countries. He's advised numerous health systems and governments on innovation and improvement. He is one of that rare handful of non-British citizens to have been honoured with a knighthood by Queen Elizabeth II. That was for his work with the NHS. As if that weren't enough, he also went on to run the Centres for Medicare and Medicaid services under President Obama. Perhaps most importantly of all, from our perspective, he shares the belief of the WISH community that the dissemination of evidence-based innovation has the capacity to improve the health of all. So it's my great pleasure